Hi, Dr. Young.
Hey, how are you? You want me to just go ahead and get started, or do you have stuff first?
Yes, sir. You can go ahead and get started.
Okay, everybody should be able to see a set of slides on your screen. If you end up wanting these at any point, you can just email us. I can send them to you. What we'll talk about today is dealing with changes related to weight loss surgery. And I cannot advance slides. I think the annotation thing is in the way. Yeah, okay. If whoever put that up needs it back, just you can push it again. I'll approve it. It should work. So we'll get started with a general overview of change and dealing with internal and external stressors. Your changes before and after surgery are many, and often in areas that are pretty extensive. Your diet has to change essentially completely, your activity level, the types of activities that you engage in, very frequently people's social interactions, a whole lot about your body image may be very different and in flux as you progress toward weight loss and better health. Much of that takes a toll on your emotional state, which can be tied to all of the things that we just talked about, particularly through stress and adjustment. Stress is essentially anything that requires you to change. It's the same for pretty much every organism on Earth. If you're used to a routine, you do something a certain way, and then something comes along to alter that, it results in stress. And stress requires adjustment. You either get used to the new thing or you get rid of the new thing and go back to whatever you were doing before. That can come from a couple of different sources. One is internal. It's the way your body physiologically feels or your cognitive processes, your thoughts. The other is external. This could be anything in your environment or about which you don't have control. Lots of different things socially that we'll talk about that may change as a result of progressing through this surgical process. And then a couple of technical terms for this because people don't always think about the second one. Distress is the kind of stress that everybody means when they say I'm stressed, like something bad has happened, something external, internal, whatever has come along, and I don't like that. I experience stress as a result. Eustress is a technical term, but it's one that basically means stress that comes from something that isn't negative. The example I use to explain this a lot of times to people in class is you ever spent time with somebody the week before they were getting married in a big wedding? They are not happy. They can be extremely stressed, like leading up to that event. And it's something that would be very positive and enjoyable for them, not something that they would reject or get rid of given the chance. So all the coping strategies that we'll talk about for all this stuff relate to this general model on the right side of your screen. It's called the cognitive model. It's essentially how all emotions work. Um, any emotion you can think of is made up of your thoughts, your feelings, your physiological feelings, like the way your body feels, and then your behaviors. So, if you're sitting here at home watching this presentation and all of a sudden a bear walked in the room where you were standing or sitting, you might have the thought that I need to get away from that bear. That's very dangerous. And you would rightfully think that it could harm you. Your body would react as a result with elevated heart rate, with tension, with maybe stomach gets upset, all the signs of fear. And then your behavior would probably be to try to get away from the bear. Very straightforward when situations actually put your life or your physical well-being at risk. Less straightforward when it comes to all these things that we're talking about because the negative outcomes are really far in the future a lot of times, and the positive outcomes that you get from doing these things a little differently may be really close in time. So one of the things you can do to deal with negative thoughts when they come up is just notice them. Very frequently, people can experience negative thoughts for long periods of time that have real implications for their health, their emotional state, They're not even aware that they're there. Noticing the first chance to change something, and also realizing that you don't have to believe everything you think. Very frequently, our brains just generate random, automatic, transient thoughts, some of which may be really negative. If you hold on to them too much, you end up suffering as a result of that. For example, like a thought in this situation here, a negative one, why haven't I lost 5 pounds this week? Maybe post-surgery. I must be a failure. It's hopeless. The surgery was useless. I'm never going to lose weight. And you may have physiological impact of those thoughts. You get tense, you get shaky, you get sick at your stomach, your heart rate elevates. And then for many people, your behavior changes in a negative direction. You might stop weighing in, stop monitoring your diet, not doing as much exercise, not checking in with your healthcare team the way that you're supposed to, and not accessing your social support, which can be extremely beneficial to dealing with these sort of things. Instead, you can also work on building strategies for cognitive flexibility. Essentially, there's more than one way to think about absolutely everything. No matter how negative something seems, somebody else that experiences the exact same thing may have a really different perspective on it. You can train yourself to consider those multiple perspectives. You don't even have to believe any one of them to be able to generate lots and lots of alternative ideas. And often the things that stress us out, we don't really have evidence for one way or another. If something happens that you worry about and you don't have any idea about the outcome, you're benefited by just believing that things are going to work out, by being able to select the option for thoughts that is least negative for you. So instead of I didn't lose 5 pounds this week, which is often unrealistic, you can think, nice job, I lost a pound. Losing a pound is better than gaining a pound. These changes are working, keep up your momentum. I can do this. This is a long-term process. It's not a one and done, and if it doesn't work, then that's it, you give up. So your feelings may be different as a result. You might be motivated, you might be energized, you might even be proud of the progress that you've made and the lifestyle changes you're attempting to make. And then you continue doing the things that are supposed to be healthy for you, particularly weighing, monitoring your diet, and making sure you attend your follow-up appointments with your medical team. There's also like a component to this, and the reason I used this example a minute ago is understanding realism associated with your intended weight loss. You got to set appropriate expectations for yourself. We do a lot of the pre-surgical psychological assessments for this process, and it is not uncommon for people to think that they're going to lose a really, really large amount of weight in a very short period of time. If you set yourself up with that expectation, thinking that you're going to drop 100 pounds in 5 or 6 weeks, and then that doesn't happen, you can end up having an emotional toll as a result. So knowing what your predicted weight loss is and when it is predicted to occur can go miles toward like keeping you on the right track as you recover and begin to lose weight after surgery. This information is included in every one of our reports. We use this like fancy mathematical calculator that's based on around 750,000 people are going through the same surgery that y'all are getting ready to have to predict very specifically, this is the typical trajectory of weight loss people experience. If you know that, then you know what to expect. You probably have an easier time adjusting to those stresses. You can also start to think like ahead of time, what's going to be hard for me? Like all the changes that everybody is helping you learn about making and that you start trying to do now, what's going to be the hardest? You do that more before surgery, it is often going to have like a better set of expectations afterward. In particular, with new information that may be difficult or historically something that you haven't had a chance to learn much about. Diet, nutrition, incredibly important for adjustment, exercise, and the physiological changes that your body will experience. if you know what to expect, you know the kinds of changes people usually undergo, you're going to experience less stress as a result because you already know that they're coming. And also, distress tolerance as a coping tool for dealing with change. You think ahead, challenges are much easier to deal with if you anticipated them. Like if you've ever had to go to an event where there was somebody there you didn't really want to talk to, and you kind of knew that you were going to have to talk to them anyway, thinking about that ahead of time and knowing what you're going to say when you're in that situation makes you more prepared for it than if you just sort of spontaneously came up with something at the moment that you experience stress. The earlier you can do these things, the easier it'll be to adjust to difficulties. It's also important to like plan for the positive side of things. Real often when people are undergoing a change as big as the one that y'all are trying to make, it's easy to get caught up in it and kind of exclude a lot of other stuff. But you shouldn't, because if you continue to engage in positive activities, stuff you find valuable, meaningful, it may actually accelerate your weight loss and make it easier to adjust to all the things that you have to do. And in the course of doing those things, you can develop real effective problem solving strategies. I won't go into that too specifically here because it can take a long time. But essentially, the key ingredient to problem solving is to slow down. That very frequently, the solutions we come up with for problems that plague us that don't work are usually generated very, very quickly. If you have enough time to think, to actually plan and organize, most of us have most of the tools we need to solve most of the problems we experience. And also training in mindfulness as a way of coping. I said in the very first slide for this stuff, monitoring your thoughts is the first step toward being able to change them. Sometimes that monitoring is hard. If you don't do this with regularity and you start to pay attention to all the noise inside your own head, you might find 50 or 100 things going all many directions at the same time. And that's not unusual. That's the way like the human brain works. We do a lot of things simultaneously. Most of those things, though, are incredibly brief. The negative thoughts that you have that float across your head in that manner are really no different than the positive ones. They're just thoughts. They may only last a second, maybe even less than that, and then they're gone. Well, think about this for yourself. Which ones do you hold on to more? Very, very frequently, you hold on to the negative ones more. And it is quantifiably much easier to do that. That's what keeps us alive as a species is we're always on the lookout for threat. But you don't have to be. Those negative thoughts that may have implications for your health are no different than the other ones. You can see them, you can notice them, you can learn to let them go. And then another method of coping with change is through the second point on that triangle that we had on the first page. That stuff before just now was thought-based. This is more physiologically based, your feelings in your body. Your eating is going to change. You physically will be able to hold much less because your stomach is much smaller. But what you might not be ready for until like you've learned about this stuff is your body starts to notice things a little differently. Some of the areas of your stomach that are going to be removed may be the ones that produce what's called satiety hormones, meaning your stomach tells your brain that you're full or you're hungry. Those things may function really differently, and you have to learn to eat even if your body is not telling you that you need to eat. And you need to learn again how to know when you're full. It's not an uncommon experience either for stuff that tastes different. An awful lot of people like find that stuff they really used to like, they don't anymore, or stuff that they didn't like, they do now. Adjusting to that is something you can anticipate and may help with reducing stress. Your weight also may change kind of fast at first. A whole lot of the weight loss is in the first 3 or 4 months post-surgery very often. That may require adjustment on its own. Everybody at this stage probably thinks like, well, that's a real good problem to have, and it is, but it's an example of what we talked about on the very first slide of eustress. It's different. Your body feels different, you look different, you may move differently. So even though it's positive, it is something that requires adjustment. And in physical activity, as you drop weight, you may find yourself able to do a whole lot more stuff. It's not uncommon for people as they lose weight, their joints don't hurt as much. They start walking, exercising, lifting weights, doing things. That kind of stuff is great for increasing your positive physical sensations, but it's different. If you haven't been doing a lot of it and your body is now like a different size, it moves differently than it did before, it takes a little bit of adjustment. So getting used to that now and trying to figure out the kinds of exercises you can do later may be extremely helpful for making that transition easier. And then something that the vast majority of Americans neglect almost entirely, and it's not just us, it's much of the world with technology inculcated in their environments, is sleep. Sleep is extremely important. It is linked to basically all mental health outcomes you can think of. If there was one thing that I could just like wave a magic wand and fix for like everybody at once, it would be sleep. Because when it goes wrong, everything else goes way downhill. You physiologically produce more cortisol if you don't sleep. And cortisol is what a lot of people call stress hormone. It has the effect of amplifying negative emotion, but it also can make you gain weight. So if you sleep poorly and you have implications of these hormones, you may not lose weight as fast. You may gain weight if it's severe enough. All of this can also change as you adapt to your new body and your new lifestyle. Like as you lose weight, your sleep may be a little bit different. Your metabolism is likely to be a little bit different. So being able to pay attention to that stuff and get it right now will really help you post-surgically. And this is really a lot easier than it might sound like, because it's not uncommon for people before they have surgery to have trouble with sleep, especially with like breathing. Apnea is very, very common in people pursuing this surgery. But it's easier than you think to try to address that stuff and improve it somewhat. You can remove a couple things that make a tremendous difference, like all by itself. If you decrease light exposure, especially from screens, about a half hour before you're trying to go to sleep, that's extremely beneficial. Um, Most of us, the last thing we do before we go to sleep is stare into a reflective surface with bright lights all around us while we brush our teeth. Get that done with a little bit earlier. You don't have to do that. You can wind down gradually, makes it easier to sleep. Likewise, not using your TV, computer, phone, like other screens in bed, your body begins to learn that it associates place with activities. So if you're looking at something bright with blue light that wakes you up, and you're always doing that in your bed, your brain begins to associate being awake with being in bed. It becomes harder to sleep. You can also just be consistent with a few more behaviors. If you go to bed at the same time, you get up at the same time, ideally without needing an alarm to wake you up out of like a deep sleep every time, you're a lot better off. And there's all kinds of research on this with people undergoing bariatric surgery that if you have a CPAP or BiPAP, a breathing device to help with sleep apnea, incredibly important to use it. There's a pretty good likelihood if you follow the typical projected weight loss that you might not need it forever. But in the short term, when you do need it, it's incredibly important to use it and stay consistent with it because it helps everything else. This is also something else that is in that calculator for predicting outcome is changes in health conditions. it's not weird for people to stop having blood sugar problems or hypertension or sleep apnea, that kind of stuff as a result of weight loss. And then having a plan for like when or if things don't go right can help you react when you're unable to sleep. The simple rule is if you're awake and tossing and turning more than like 15 minutes in bed, you get up and go somewhere else because your brain is learning, like we were talking about a minute ago. You associate being in bed with being restless with waking up. Go someplace where you don't sleep and engage in something incredibly boring that doesn't involve an electronic screen until you're tired enough to go back to sleep. For a lot of guys my age, the activity I suggest is go to the store and buy you a magazine on knitting and then sit up at night and read that when you can't sleep because you're probably in all likelihood not going to be interested in that activity. It's enough to wind your brain down and make you fatigued. But anything boring will do. You can read the dictionary if you want, if it puts you to sleep. So but the last component of that triangle is behaviors. And in this instance, this has a lot to do with habit formation. And habit formation involves two things. One, breaking an existing pattern, especially one that may be unhealthy for you. And then two, making a new one. The first one is a whole lot easier to do if you do the second one at the same time. Very frequently, people think, well, I'll stop this and then I'll learn how to do something else. But it usually doesn't work as well as gradually trying to replace the negative habit with a better one. And slower is usually more useful for this process. If you try to do this quick, it is very likely that you slip back into the bad habit before you know it because it's too much to change at once. But little bitty steps, it's a whole lot easier to get there incrementally. There's also a bunch of methods of physical relaxation. One thing that a lot of people don't realize about stress is it makes your body tense. You know, just like you can see people carry their stress sometimes in their shoulders, their neck, their head, sometimes to the point that you might have been doing that for days or weeks or even longer, you don't even realize it. But if you train yourself on formal methods of physical relaxation, you can get rid of that. And then one of those 3 points on that triangle is a whole lot better as a result. It makes it a little bit easier for you to function and to not be as negatively impacted. And social support, another form of behavior that not everybody attends to beforehand. Your family, like important, especially in the short term right after surgery, just for tangible help with stuff, but also caring about you, checking in on you, encouraging you, your friends, but also each other. You can engage in a whole bunch of different kinds of support groups. We being Delta Autumn Consulting, the company that my wife and I run over in Oxford, we provide these at no cost. Right now, they're only once a month because we don't have a lot of people signed up, but to the degree people want to, we can make these every week. Each other going through the same things can be a really good source of social support. You live near somebody, you can work out with them, you can work on changing your diet together. It's very positive to have social connection around these things. And in body image, the second broad category of what we're going to talk about tonight can be the cause of much stress, especially like if you tried everything you can think of to lose weight, it hasn't worked. You have negativity about your physical appearance. It's difficult. It's also difficult to predict or to think about what you might look like in the future because you may not know. If you've been overweight a long time and you don't want to be, predicting your future body can be very, very difficult. You also have considerations for things that may have social implications, like when you lose a bunch of weight, in the first few months after surgery, it's not unlikely that everybody you know is kind of going to ask you about that. Be like, hey, great, that's awesome. Like, how did you do it? Planning ahead of time what you're going to say can be really useful. Practicing that explanation with people close to you who know what you're going through can give you a really good tool to be able to effortlessly handle those situations when they come up, wherever. And you can decide what you tell people. Do you want to tell people you underwent surgery or not? If not, what do you want to tell them instead? Mindfulness can help with that. If you attend to those thoughts that are negative about yourself and your appearance, you got a way better chance of being able to change them. Or, as we'll talk about in a minute, to harness those. Negativity is not always bad. If there's something you don't like and it spurs you to work to change it, and you don't get bogged down in the negativity, that can be a very motivational strategy. And coping in advance, being able to think about your trajectory of weight loss, what it's going to do to your body and how you're going to look, and how you're going to contend with any sort of negativity you might experience. The broad stroke thing that I wish everybody heard, before the surgery, you get to decide how you perceive yourself. Nobody else matters in that. Your body image is your own. What somebody else says is utterly irrelevant. Now, that's easier said than done because it can be negative with external implications. But if you adhere to this, you'd be a whole lot better off than if you're always looking externally to define those things. And along with body image, like there are two separate areas to think about with the way people perceive themselves. And this is sort of tricky because they look opposite, but they're not opposite. These are actually two different lines of consideration. One is positive body image, or what a lot of people doing research in this area call appreciation. There's positive factors about my body. It has functional capacities. It can do stuff. There are things that I like. Negative body image is any sort of negative or like aspersion that you have toward your own physical appearance. This is not the same as the opposite of positive. They don't exist on one line. You can think a whole bunch of negative things, but still have positive thoughts at the same time. As you lose weight, it's really great to remember that. You can still have negative thoughts and wish that things were a little bit different, a little bit faster, and have appreciation for the things that are going right. As you lose weight, maybe you hurt less, maybe you're more mobile, maybe you can engage in exercise a lot more than you did before. If you remember to slow down and pay attention to those things, it can help you in terms of adjustment and maybe minimize the negativity of the negative side of things. Yeah, I think I said a whole bunch of this stuff already, but body negativity is a big deal in trying to change weight. Sometimes this can be general, just you have a negative self-perception all over. Sometimes this can be specific to a particular area of your body. Often that goes hand in hand with like limited appreciation for what your body's able to do or anything positive about it. And then this third one is the reason that it is so difficult to adhere to the thing that I said on the last slide of you getting to decide how you feel about you, because it's easy to internalize this. Our whole culture like suggests that being bigger is a negative thing. Every media image you ever see, like everything that you're assailed with all the time says that. It delivers that message. And in many senses, it's one of the last like socially acceptable prejudices. Everybody knows, you shouldn't say things that are biased against a group of people, but you hear people say this about people that are overweight all the time. It is very easy to let that get to you. But if you're able to be mindful, recognize what's happening, realize your reaction to it, you may have an easier time letting it go because ultimately none of that stuff matters. You're taking the steps that you need to be able to make your life better, more functional, your body healthier. It doesn't matter what anybody else thinks. and you can learn to tune that stuff out. Also, like one thing that in research is very frequent in people that lose a lot of weight through these procedures, you end up with a bit of excess skin, and not everybody likes that. Learning about the procedures that can change that after you go through the surgery can be useful. One of the most common is called body contouring. What it means is trimming excess skin, and it's often done through like a cosmetic surgeon. If you learn about that stuff ahead of time and you see how your body reacts as you begin to lose weight, you can be well prepared for what you might do to change that in the future. And also with body image, we try to remind everybody that your body image is more than just a number on a scale. I mean, of course, you're going to be happy and reinforced if the number goes down. That's great. That's healthy. But it's also tied up with your function. What you can do is easily as important as what that number is, because that's ultimately why most of us want to lose weight. You are healthier, you're more functional, you can do the things that you want to do in life. Appreciation for those functions, also the reduced need for medication. As I was saying a few minutes ago, it is pretty common that people can get rid of a lot of their medications as they successfully lose weight. That's really positive for most people, especially if you take, 5, 6 different things every day. Nobody is going to be upset to turn some of those loose. A very useful thing. The clothes fit better. A lot of people suggest that like shopping for new clothes when they've started to drop weight is really positive, very reinforcing for them. And ultimately, probably one of the biggest implications of this is it's good for your health. You live longer. If you drop a lot of excess weight, your health is going to be better for longer, and you're going to be more functional during that time. Your life improves not only quality, but quantity, how long you live. Acceptance can also be a really good thing to train for this. And again, I won't take all the time to go into exactly how that works, but you can learn to accept some things that you don't like. Notice negativity is fine. Realize that like literally everyone has had similar thoughts about themselves. Anybody you can think of who is the most like stereotypically beautiful, fit, like fancy movie star, they have had the same negative thoughts about themselves that you might have. And that's okay to have those thoughts. You just want to make sure that it spurs motivated improvement and healthy changes, not getting bogged down in it and depressed by it. Use it to monitor yourself and then let it go. Because negativity, as long as it's transient, is not likely to cause a whole lot of problems. And I said this already, but this can help a lot with body image too, is knowing what you expect to lose at what point in time. If you're thinking you're going to shed 100 pounds in just a few weeks, then you might think that you're going to look very, very different in a month or two. And if your expectation isn't reality, that can get you down and get you dejected. If your expectation is pretty accurate, though, then you can kind of begin to gauge what you might look like, what you might feel like, how that affects your overall psyche. And then another thing you can do for not just body image, but any sort of coping is learn more stuff. Diet in particular. Make your appointments, prior to surgery, but also your follow-ups for adjustment to how you're going to need to eat differently. Exercise, that can be really great to consult with somebody who does this to learn about how to fit you and your lifestyle, any sort of physical limitations you might have. Because a lot of people think like I just can't do anything. I'm hurt or I'm too heavy, like it's painful. But generally, you can cultivate some form of strategy to increase your activity. And also like about body contouring, if it's relevant to you, if it's going to matter to you for excess skin and you're losing a lot of weight, then prepare for that. pay attention to it and learn what it means ahead of time, it can enhance your body. And then finally, the last part of what we're going to talk about is impulsive or addictive behaviors, where it's really easy to get stuck on certain things. Changes in your activity level post-surgery can sometimes be not so good. It's not uncommon for people to overeat, to maybe continue to overeat if they don't change their diet appropriately. Alcohol use can go up. We'll talk about that very specifically in a minute. Drugs, cigarettes, sometimes like other compulsive behaviors like shopping, spending a bunch of money you don't have, getting stuck on internet. Those are all things that we associate with compulsive or like addictive behaviors. You've probably seen a million TV shows and movies that reflect those exact things. But you also got to watch out for the healthy side of change. That sometimes you may get stuck on exercise in a similar manner or a healthy diet. It's a psychological condition called orthorexia. People pay so much attention to being healthy for every single thing that goes in their mouth that they end up getting obsessed with it. And what is, potentially a very healthy behavior taken to an extreme isn't anymore. One of the others that is risky that not everybody pays attention to because it seems like a good thing is more frequent and different socialization. Often, if you have a negative body image, if you have some social anxiety about the way people judge you, you might pull back from social interactions. But as you lose weight and you feel better and you form a more positive image, you want to go and do stuff. You want to meet people. You want to be around and do, fun things. Sometimes that can get carried away, and you can end up in situations that involve this stuff on this first list, alcohol in particular. So you can avoid that if you just think about it ahead of time. Going back to our coping strategies, know yourself and develop something that's going to work for you. Also, like attend to progress and body image. Progress is progress. It's good. It may not be as fast as you want. It may not be like as much as you want all the time, but keep in mind that this is the long-term process, and you may end up having an easier time avoiding some of these negative changes. There's also a whole bunch of distress tolerance tools that you can learn to be mindful of your cravings. But cravings are kind of a weird human experience. It's when something hits you and you want something to eat that you know you really shouldn't have to eat, for example. It can be really intense. We're one of the only animals that's actually able to conjure images and physiologically react as though we are in that experience when it's not really happening. Most other animals aren't capable of that. They deal with concrete things right in front of them all the time. Most of what distresses us isn't like that, though. It's abstract. It's not happening right now, but it feels like it is. But it's brief. If you learn to ride that out like a wave of emotion and you plan for it ahead of time, like, hey, this is probably going to happen, and now I know how to deal with it. Once it passes, it's gone. You don't end up like having to engage in negative behavior as a result. Think ahead and consider those things about your environment. If everybody you hang out with, like after church on Sunday, they end up having a really big potluck meal with all kinds of bad food and sugary drinks, that environment is maybe not potentially going to be the easiest for you. So you either have to learn to deal with it in that environment or you have to stay out of that environment. Paying attention to that ahead of time will help. Also, who you spend time with and why. Sometimes as you engage in more socialization, a lot of the people you hang out with, they might do some things that are unhealthy, drinking in particular. And as we'll talk about in a minute, that can be a real risk. Know what they like to do and know whether that's going to fit with your intended lifestyle or not. And if not, maybe don't hang around with those people or hang around with them in a context where the negative stuff is not possible, especially if you know you have a tendency to do too much of something. because really, like I put quotes up a minute ago for addiction. It's not a word we actually use anymore for behavioral science. The nature of addiction is habit formation, and often it is really easy to form habits if you have a high degree of obsessionality, meaning you repeat stuff a lot, you get stuck on things kind of easy. And then before you know it, like those negative habits are formed so solidly that it becomes unhealthy and very, very difficult to get rid of. So you make a plan ahead of time for how to avoid these negative outcomes, and you lean on your social network, your family, your friends, the people you can trust, each other, if you make those connections leading up to surgery to make this easier, to stay out of like problematic situations that might be harmful to you. In particular, alcohol and tobacco in research literature are among the biggest risks. Part of this is just because you can get it everywhere. Legal substances, they're easy to find and access. They tend to be tied to an awful lot of social events. In the Southeast, we tend to do a whole lot more of both of these things than the rest of the country. It's available and infused into our social interactions to such a degree that it's really easy to fall into bad habits. It's also the case that an awful lot of people leading up to surgery quit doing one or both of these things specifically for the surgery. And then after the surgery, maybe they don't necessarily plan this, but they kind of quickly go back to doing those things. They're able to eat a little bit of solid food, they're up and around, they're losing weight, and then they start smoking again. This is super easy advice, and it's one that you probably hear from every healthcare provider you ever contact. Don't. If you quit smoking, stay quit smoking because that is among the worst things you can do to yourself. But it's easier to say that than to do that. So learning coping strategies, thinking ahead, being mindful of those sort of things, you can avoid a negative outcome. It's also the case that people after undergoing these surgeries are at really greatly elevated risk to misuse alcohol. And this statement is not scientific, it's just my impression of it. It's got to do with socialization, that you're doing more, you're out more, you're enjoying yourself more than you might have in the past. It's easy to fall into those habits because they're ingrained in our social culture. But again, don't. These things, when you know you're at greater risk for it, when your body may metabolize alcohol a little bit differently, it makes it easier to get stuck. And to be fair, most of the research that suggests this extreme elevation in risk following surgery was with a different procedure than y'all are likely to be undergoing. It wasn't with the gastric sleeve, it was with the Roux-en-Y, a different procedure. Regardless, if you know this is a risk and you know it's coming, it makes it easier for you to step out of the way and to get a handle on your behavior before a little habit becomes a big habit, becomes something that becomes very difficult to break. And also, marijuana, because this has always been fairly easy to obtain, but anymore it is really easy to obtain because you can get it legally. The bar for one of them cards to go to the dispensary is really not particularly high, no pun intended. You can access this stuff if you want to, but it's not good for you. The scientific support for its usage as medicinal is really minimal for all but just a very few conditions, none of which are emotional. What we know from a long history of studying what this does to your emotions is it almost always makes the bad stuff worse. Whatever negative thing you experience, like after you take marijuana and after the effects wear off, is elevated. Even though during the short term, when you experience the effects of the drug, it doesn't feel like that at all. It can feel, like an escape, like you're turning that negative emotion off. But it's risky for your overall health behavior. It's not just for emotionality either. You might be perfectly well adjusted, have no emotional difficulties at all, but marijuana is also often a very social drug. It's something that you do in a group. It decreases your inhibition and simultaneously has the effect of making you hungry. And the combination of those things is it's bad. It's a recipe to overeat and engage in unhealthy behavior. And there's some long-term evidence when you look at this stuff from research trials that followed people over a period of years, that if people are using marijuana after surgery, they lose much less weight. That research is not all that extensive. There are only a few studies that I could find, but they followed people for a very long time and measured them very carefully, and it seems like there are strong implications for that. Okay, so you listened to me yammer for a long time now. This is, let's leave this up for a minute. If anybody wants to get a hold of us, you can through these channels. You can also get information about our support groups. If there happens to be a massive outpouring of interest in that kind of thing, then we are able to do them a lot more frequently than we are right now. And I think that's about all I have. I believe we can take questions and go over anything anybody might want to talk about now. Is that right, Vivian?
Yes.
Okay, and those will pop up in the chat box.
Yes.
Cool.
If
So anybody
you have
have?
questions, you can use the chat box and Dr. Young will repeat the question and answer the question.
Or if I can anyway.
Any questions?
Yep, at least one. I think she's typing.
Okay.
What meetings are you willing to have that you mentioned, more support group meetings? Yeah, and often we begin those type of meetings with more specific information for a lot of the things that we talked about. So, today was kind of an overview to say, hey, these things are there, you can learn them, but the support group starts with 20, 30 minutes on this is how you do it. Here's instruction in that tool and that skill so you can put it to work yourself. See, second question, what are your thoughts on revision? I can't comment a whole lot from a surgical perspective because I didn't go to medical school, but I have read a lot of outcome research on that to suggest that it's typically very effective. It often has been studied after gastric banding, which isn't done quite as much anymore because a lot of people can have trouble with it depending how the procedure goes. But there's nothing to suggest that it is negative or the outcome is any different than somebody undergoing this as a first procedure. The limit of support groups, we don't actually have one because we are doing that virtually. So I think Zoom probably has an upper limit to how many people can enroll, but it's thousands. So we're very unlikely to hit the ceiling on that anytime soon. How much weight loss is realistic? That can be really different, and it depends on a whole lot of factors. The math and the research behind that calculator we use to predict this stuff has been developed by a national organization based on 750,000 plus people that have been through the procedure. It's specific to the procedure you undergo. It's specific to your age, your ethnicity, your gender, your body weight at the time that you're having surgery, and a whole bunch of different health conditions that you can enter as variables to predict. It's not at all uncommon for the end result of that to be like 60, 70% of excess body weight in the first year, with the majority of that weight loss occurring in the first 6 to 8 months. And then people that continue to push harder for a healthier lifestyle being able to continue on a better pace longer term. Would you be willing to do support group meetings for post-surgery patients or ones that have had surgery in the past? Absolutely. In fact, I think that's one of the areas that can really help people adjust to this sort of stuff. The more you're able to talk to people, to learn skills, to contend with things you couldn't anticipate or you didn't anticipate before surgery, the better off you're going to be to getting through those situations after surgery. In fact, there's a couple of randomized trials that have done even just 4 sessions of something similar to what we're doing after surgery. And those people were healthier, more well adjusted, and lost more weight as a result in just, four sessions. That was it. What type of pain will you have after surgery? That often, from what I understand, and this is definitely not an area of expertise for me. So, Vivian, if I'm way off, please correct me. That can be pretty individualized. That you're going to be up and around basically the same day of surgery, and the worst part of it for most people is adjustment to where they puffed you up to be able to fit all the instruments. Your ribs, your intercostal muscles, pretty sore for a while. But the pain is not like extensive enough that it is going to knock you down, long term. You just have to be careful about how you move for a while.
Yes, I would say that's correct. In all honesty, I'm 12 years out. When I had my surgery, I it wasn't anything that I didn't already expect as far as pain, incisions, burned. Overall, stomach just kind of felt a little yuck. I really wasn't that nauseated. Um, I would say most pain was really not related to like actual incisions. It was mostly just the trapped CO2 from being insufflated for the laparoscopic part of the surgery. So if anyone has ever had laparoscopic surgery, you know what I mean when I say trapped gas. So that was the most painful part, and it wasn't excruciating. It's just uncomfortable.
Yeah, you adjust pretty quick. I asked a surgeon about that one time. I was like, why doesn't this hurt more? It's like, you don't need pain receptors on the inside. So a lot of the stuff that you think would be very painful in terms of the physical changes isn't because your body's not set up that way.
Yes,
Uh,
and also now they are actually doing, we do participate in part of the ERAS protocol to try to help decrease post-op pain,
yeah,
and also along with anesthesia doing blocks to decrease post-op pain.
yeah, tons of evidence for that suggests that it's super helpful, especially in the immediate short term. Gets you up and moving a lot. There's a question about obsessionality as relates to addiction. A lot of the stuff you can read on that if you are interested is there's a guy named David Clark at Oxford in England, like the big Oxford, not the one where I live, that studies obsessionality and its impact on behavioral formation. Um, Motivational interviewing could be a useful thing to read, although they don't talk as much about like the nature of what creates addiction. Obsessionality is a component of the entire intervention. They're addressing that stuff all the time. And if you're interested, like at any point in, detailed and boring academic references, you can shoot us an email through the website. I'm happy to send you more than you probably ever want to read. I guess I didn't say that before, but my side job is as a college professor. Like I really like to read and do research. How long after surgery will solid foods be able to be introduced back into our diet? I think this is also kind of individualized, but if I understand correctly, you're a couple weeks out, you're starting to introduce small bits, and then by 4 to 6 weeks, you're pretty much back on a regular diet. Is that pretty close?
Well, usually 2 weeks, you're on a full liquid diet, and that will be for 30 days. So
Okay.
you're in your fifth week, going into your sixth week before you actually get a chance to have something that you can actually chew.
Okay. Yeah, so a little bit longer. Sorry about that. I'm glad you're here to check that because I wasn't entirely sure. Um,
But you will see the dietitian every time there's a diet change. You will visit with the dietitian and she'll review everything with you as far as the textures, what you can have. She will review all of that
yeah,
information.
that's the importance of those follow-up appointments because every stage, like you need to be assessed to make sure you're ready and have somebody that knows what they're talking about say it's all right to start to shift your behaviors. A lot of people that neglect that, you get sick, you can have stuff negative come up, but you may also not adjust as easily. Is the sleeve safer than the gastric bypass? Um, sort of. Yes, I'll come down like more on yes than no. When you compare it to the other prevalent procedure that is still done in a whole lot of the rest of the world, the Roux and Y, weight loss is very similar. Under surgery is less in the sleeve because it's ultimately less invasive. They don't have to move your intestines anywhere. And the rate of infection, particularly sepsis, within the first 30 days after surgery for hospital readmission, is way less for gastric sleeve. So, in the sense of like surgical risk, it's safer. In the sense of long-term adaptation, you probably are pretty likely to lose the same amount of weight in either case. Mostly in the United States, from what I understand, the people that still undergo the Roux Y are they have metabolic conditions because they can also change like your nutrient absorption. That's another risk with the older procedure that if your body kind of overcorrects, you may not be able to absorb enough nutrients to be adequately nourished. Um, Yeah, and then there's another one that says, I heard you lose more weight with a bypass in the trials that have compared those things head to head in randomized fashion, not just matching people, but like people were randomized to procedure. That wasn't the case. Weight loss was pretty comparable. But for people with those metabolic conditions I was talking about, it is. They lose a lot more weight because it adjusts the way that their body processes stuff. Somebody says I had the sleeve in 2018 and gained a little bit of weight back. I want to get back into living a healthy lifestyle. It's post-bariatric. Do you have advice? Yeah, like work slowly to make changes, to not really get hung up on the fact that maybe you gain a little weight, you're not maintaining where you want to be, and incrementally introduce change slowly. If you're interested in it too, attending those support groups, we have a whole bunch of information about how to do some of those things from a behavioral perspective. Somebody else says, I'm excited at the thought of getting healthier and being able to do more things that my weight currently holds me back from doing, but I still find myself being overwhelmed with nerves regarding surgery. Any advice to reset my train of thought or ease my nerves? I can answer this partially from a statistical perspective and maybe like a personal one too. I'm mildly afraid to fly. I don't like it. Anything that big that can fall that far that I'm not driving like kind of makes me nervous. But I always am able to get on the plane anyway because I think about the statistics behind the risk that it is by far the safest form of travel you could engage in, especially long-term travel. You try to drive that far, you're at much greater risk of traffic accidents. The same is true for the surgery. Some people experience some complications or negative outcomes, but in general, those tend to be very minimal. People know what they're doing, and your surgeons here, in particular, data from within the clinic are real likely to suggest a better than average rate of um, avoiding post-surgical complications, and those are really low to start with. So even though it seems like no one wants to undergo surgery for the most part, it is a very safe and very, very well researched and refined procedure. Also, like if you decide that nerves are a little more that are going to be reduced for knowing that fact, there's a whole bunch of stuff you can do to address that very specifically. Cognitive behavioral therapy, which is what we were talking about for most of the first half of the presentation today, can be really great for that. Bunch of specific tools and techniques to be able to contend with negative emotion. It's also the kind of stuff we teach in those support groups and in the first bit of the group meeting. What's the best time to start liquid diet before surgery? I think that's usually 5-ish days. Is that right, Vivian?
Well, the liquid diet, you'll have pre-surgery education, and during that education, you will also have education with the dietitian, and she will go over the diet stages pre-surgery. So it mostly consists of high protein, low carb, and 4 days prior to the surgery, it is the liquid phase.
4 days, sorry, 4 days. I know it wasn't quite a week, but it was 4 days, but also supervised. That's an incredibly important point. Consultation that tell you exactly what to expect, but also monitor your individual vitals and adaptation to make sure you're doing it at the right time. Is it common to have hair loss after the surgery? Um, Common in the sense that it happens to a appreciable amount of people potentially, but the base rate is the percentage of people that experience that is still very small. And that tends to occur way worse for the older procedure that has metabolic changes because the rate of weight loss is often what predicts hair loss. And in many cases, even if you do experience that kind of thing, when it's because of short-term weight loss, rapid in response to surgery, it's also reversible. So it's not something that everybody ends up experiencing as a permanent sense. As my sense, that's a different cause for that sort of stuff. It's safe to do minimum alcohol in social situations, or should you stay away forever? I guess you can answer that a couple ways. Like, is it going to be, skull and crossbones, like dangerous for you to have a sip now and then? Probably not. Although your medical team would have a much more informed opinion about that than I would. From a behavioral perspective, it's something that is really, really easy to get carried away with. And your physiology works differently, your body processes differently. From my perspective, it probably is a whole lot safer to just avoid it. But if that's not necessarily on your agenda, I don't think a small amount now and again is going to be extraordinarily harmful once you've recovered from surgery. But please correct me if that's not true, Vivian.
Yeah, we do recommend that you do sustain from alcohol at least for the first 3 to 6 months after surgery. But you also have to remember that alcohol is also a liquid calorie,
Yeah, yeah,
and you
sugar is
do
one
want to
too.
try to avoid
Yeah,
liquid
yeah, a lot of
calories.
people try to drown the taste in like sugary, fruity stuff, but it's another risk associated with that.
Yes, and it's automatically absorbed in the stomach, so therefore it's not going to take very much for you to start feeling that drink. So you really need to be careful. Starting to drink early after the operation can cause some patients to have pancreatitis.
Yeah.
You want to be careful about it.
And what I always try to tell people is like your body's going through a big change, especially in the area that is related to processing this exact drug. It is literally diluted poison. If you drink like, 12, 16 ounces of pure alcohol, it'll kill you. If you have, a high enough concentration in your blood, you shut off. It's very easy for that to be exceeded post surgery because of the differences in the way you metabolize it. A few years out from the sleeve surgery, and I'd love to find a support group and know others that would definitely want to attend as well. Awesome. Like, call us, we'll get on the list. You can email us through the website too. We'd be happy to start doing that with great regularity if people are interested. And will exercise help with loose skin after the surgery, or is contour better or maybe even necessary? Often if you lose weight really, really fast and a lot of it, exercise won't help. You end up with excess skin, more or less. It's not your adipose tissue on internal, it's that you have extra skin because you shrank really fast, more or less. So often, if you maintain that weight and you lost really quickly, contouring is pretty much the only way to get rid of it. But it's also not something that necessarily occurs for everybody or bothers everybody. It's really only if you find it negative for the way that you view yourself that you might look into contouring as a solution for that. I think that's the end of the list of questions. Does anybody have others? Oh, one more. Let's see. Body image has been difficult at times throughout the process. Any good articles or reads that you know of that would be beneficial? It's more so that I don't always see the weight loss that others see. There's a couple books, I guess, that are less textbooky by a guy named Chris Fairburn, one of which is Cognitive Behavioral Therapy Enhanced, that talks a lot about body image issues. He's one of the biggest researchers in the world for things like that. He approaches it way from a eating disorder perspective, but a whole lot of his books are have a more body image focus at the same time. You probably don't want any of the ones that you don't find on first part of the search on Amazon though, because he's pretty wordy and academic too. It's horrible to try to read. Thanks for information and time. Like very happy to do it, no trouble. When's it safe to travel, drive, or fly for after surgery? I don't actually know about flying. Is that
Um,
implicated
we ask that you do no long travel, and that's anything greater than an hour
for
for 6 weeks, and
6
that
weeks?
includes flights.
Yeah, and some surgeries could, put you at risk of blood clots and stuff. But I didn't know if
Hmm.
this was one like that or not.
Yes, it is. And if you live, we do have patients who travel 2 to 3 hours for the surgery, and if that's the case, you will have to stop at least every 30 to 45 minutes, get out and walk around to try to
Yeah,
help reduce that risk.
yeah. No, that's good. It keeps you moving, but that makes the travel a little easier too. Assuming we must grind and crush any medications that aren't liquid form post-surgery, are they able to be taken that way post-op if you're doing liquid diet only? I think so, right?
But
If you
yes,
crush them, it's all right.
well, yes, after the surgery, everything is crushed open, chewable, or liquid for the first 15 weeks.
And how long after surgery would be able to go back to work? I think that probably varies depending on what kind of work you do. You're not supposed to lift anything heavier than just a couple pounds for about a month, I think. But I think most people are back at work pretty quick. They're sore and maybe a little uncomfortable at first, but a few days, is that
Yeah.
pretty standard?
Well, usually 2 weeks if you have a job where you're not having to lift anything greater than 10 pounds and pushing and tugging. If you have a job that requires that, then it's 6 weeks.
Yeah,
And it's really basically not like some people say, well, I have a job and all I do is just sit at a desk. And that's fine. But mainly, you want to take the appropriate amount of time to get acclimated to all of the new changes. It's not just about, oh, I feel fine, I'm going back to work. You have to realize that when you go back to work, when you get busy, you're not going to desire water, protein. You literally have to set timers because you're not going to desire that but you're having to do it because that's a requirement.
Yep.
So when you get busy at work, you don't think about it if you're not setting timers and being very attentive to what you're doing.
Yeah, that's a
So,
good point.
yes, you need to be working on yourself those 2 weeks. And if you want to go back to work after the 2 weeks, as long as your job requires the less of force lifting, that's fine. But you also want to make sure that you're up to par with your fluids, you're up to par with your protein intake, and you're able to actually get your fluids and protein in while you're at work and you can get up and move around. If you can't do those things, then it's not a good idea to go back to work that early.
Yeah, and it's sort of in line with what we were talking about before too, for slow habit formation. Yeah, having a couple weeks to get right and get used to stuff allows you to establish positive habits. By the time you go back, you may be able to contend with those distractions a whole lot more than if you're just thrown back into it, the next day or two.
Yes.
And that's kind of awesome that you formally recommend that too, because it's harder for whoever you work for to argue with you when your doctor tells you you shouldn't be at work.
Yes. And at some places, like some people will say, well, I can go back to work and I can just have some of my coworkers who will help me from a lifting standpoint. But also, you have some companies that will not allow you to go back with restrictions unless you were hurt on the job.
Mhm.
So, it just kind of depends on what your particular job requires. But I went back to work. I was working in surgery, but I had to have a plan. I had to have a
Right.
plan as to how many ounces of fluid and protein I was going to have down before I even went to work. When I got to work, how many ounces I was going to drink before I was ready to go into a room, when I would get my break, how many ounces I was going to drink. So you need to have a plan. You really cannot fly by the seat of your pants with this surgery and be successful.
Yeah, and that's probably goes for like planning it with your job too. If you know ahead of time what to expect and what they expect, it's less stressful as a result. Do you all help with the plan? If you all is us, that's the kind of thing that could real easily come up in support groups or the context of therapy. If you all is surgical side, like medical, I'm not sure.
Any more questions? So, as far as the help with the plan, well, we will give you, of course, your pre surgery information as far as your diet. And we'll also give you information the day of your discharge. You have another class that will go into the first 2 weeks until you come back for your 2 week hospital return. So during that time frame, you're going to know what you need to do. It's just getting it down packed and actually getting structured with it. So, like, you can't sleep in late, waking up at 10, 11 o'clock, and think that you're going to be able to achieve 64 ounces of fluid and 80 grams of protein by the end of the night, 2 days after, 4 or 5 days after surgery. So you can't play catch up. The goal is to get up in enough time frame. I would say 7:30, 8 o'clock. Get started with your fluids, and you're consistently doing something from fluid to protein, walking throughout the entire day. I always tell patients it's kind of like a job that you're not getting paid for. It
Yeah,
is a full-time job.
good way to think about it. Another message came up said, I mean, plan for going back to work. Not necessarily the whole tangible thing, but just are people going to help monitor and figure out when that's going to be the case?
No, you do the monitoring. It's up to you to set a plan because only you know your work schedule, the intensity of your job. For instance, like someone that works on the floor, the nurse, and they go back to work. Well, if you don't have a plan as far as that when you get to work, the first 3 hours, you may already know that you're just going to be from one room to the next. So you need to have a plan as to, okay, well, when am I going to stop and drink? When am I going to stop and get 10 or 15 grams of protein down? When you need to make a plan based on your job and what you know that you will be doing when you go back to work and how you can fit those things in.
Yeah, that's the kind of thing that like habit formation, behavioral tasks can maybe help with. We cover a little bit of that, like very explicitly for what to expect, how to adjust, how to do that kind of thing in those support groups. And yeah, I can totally send you a copy of these slides. If you let us know, you can email me directly to the website and I'll respond to you with them.
All right. Any more questions?
Looks like that's it.
All righty. So, like Dr. Young said, if you need to ask him a question or want more information, you can send them an email, and the email address is on the screen, and also they have a phone number. Um, he's more than welcome to help. And Dr. Young, I really appreciate you doing this tonight.
Sure, no trouble. Glad to be here.
Thanks to everyone who attended.